We are live! Good evening, everyone, and welcome everybody to the third episode of Meet the Specialist series brought to you by University of Malaya Medical Society, UMMC. My name is Khai Siang, a final medical student from University of Malaya, and I will be your host tonight. First of all, thank you very much to the Career Planning Unit of the UMMC Education Bureau, especially Raymond and Anis, for giving me this opportunity to be the host today. Thank you, and this is my first time being a host, so please forgive me if I do any mistake later, okay? Our topic today is medical microbiology. We will have a consultant clinical microbiologist from University of Malaya Medical Center, UMMC, here with us today. So please like, react, and share our live stream to your friends because our target view today for the live stream is 200 views. So please help us to get more viewers and allow us to achieve the target. Please, thank you. If you have not followed our Facebook page yet, please like and subscribe our MEDSOC Facebook page so that we can let you know our future events. So before we get started, let me show you this section here. This section. If you are using mobile device, should be this section. And if you are using a laptop or desktop, will be here. The comment section. You can interact with me and our guests anytime during our live stream. So let me try out the comment section. See whether I can read your comments on the spot. You can say hi to me. Oh, hello, Kamal. Hi. You can say hi to me. Let me know whether I'm speaking too loud, too soft. My camera, is it okay? My position, is it okay? The connection, is it okay? And many more. Okay. So can I have some reply? Hello. Okay, can I have some hands from maybe preclinical years, stage 1 and 2? Anyone from stage 1 and 2? We have 29 viewers here. Hello, hi Ahmad, Ridwan. Hi Raymond. Hello. Okay. Is my speaker okay? My microphone okay? Everything okay? Okay. Hi Mirza. Okay, good. Thank you. So, anyone here is not from UM? Maybe you can voice out or anything? Okay. And congratulations to the freshies who just got the offer to UM. I'm not sure whether you guys are here or not, but anyway, congratulations. And congratulations to stage 1 students who just completed their BAs, and all the best to stage 2 students who are having their study weeks now. All the best. Okay. So again, if you just got in and you are watching this now, good evening and welcome to the third episode of Meet the Specialist series brought to you by University of Malaya Medical Society, UMMC. My name is Khai Siang and I will be your host tonight. This is the third episode of the series, so if you have missed any previous episode, you can always go to our Facebook page and watch the replays. Let me emphasize one more time, our target views is 200 views, 200 views. So please help us like and share our live stream to your friends. Is it okay? Deal? Okay, now we have 34 viewers. Okay, I hope we can achieve the target. So tonight's session will be an interactive session with our guest, Dr. Nadia. So if you have anything to say, any question to ask, do not hesitate to leave a comment at this section. Oh, sorry. I closed the 200. Okay. This section, if you are using mobile device, is this section. And if you are using a laptop or desktop, with this section. Okay. Leave your comment here. Do not hesitate. Don't be shy. But if you are shy to comment, but you have burning question to ask, don't worry. We have another platform for you to leave your question. You can go to our description and click on the Google Form link to fill in your questions. I will keep an eye on the form as well as the comment section and help you guys to ask Dr. Nadia later. Okay? Dr. Nadia is an approachable lecturer who always treats her students like her friends. She is my research supervisor last year during my elective posting. She is also active in training and encouraging students to go for academic competitions. I was in her training team a few years back and we went to various universities to participate in different competitions. We even went to Bangkok, Thailand to participate SIRIRA International Medical Microbiology, Parasitology and Immunology competition, or in short we call SIMPIC. And we were the semi-finalists for the past 2 years. Okay, so it's about the time. Tonight, we have Dr. Nadia Atiya, a consultant clinical microbiologist at University of Malaya Medical Center, here with us for 1.5 hours. Dr. Nadia obtained her medical degree from the National University of Ireland in 2007 and her master degree and specialist qualification in medical microbiology from the University of Malaya in 2013. She is currently the head of the Diagnostic Microbacteriology Unit and the Deputy Chairman of the Tuberculosis Committee at University of Malaya Medical Center, UMMC. She is certified and registered as a medical specialist in medical microbiology in the National Specialist Register, and she has been a life member of the College of Pathologists, Academy of Medicine of Malaysia since 2020. She is also a member of the Malaysian Medical Association, MMA, the Malaysian Society of Infectious Disease and Chemotherapy, the American Society for Microbiology, the European Society of Clinical Microbiology and Infectious Disease, and the International Society for Infectious Diseases. Dr. Nadia is also a senior lecturer at the Faculty of Medicine, University of Malaya. She was a recipient of the Excellence Service Award in 2017 and 2020. And she also won the Best Paraclinical Lecturer Award in 2018. She finds teaching the most enjoyable aspect of her job and is especially passionate about getting her medical students to excel beyond the classroom. Since 2016, she has coached and trained many medical students for various national and international intermedical school competitions. So without further ado, please welcome Dr. Nadia Atiya. Welcome.
Hi. Hi, everyone.
Hi, Doctor. Nice to see you. How are you?
I'm okay, good. Thank you for the introduction.
Okay, thank you so much for being here. I can tell I'm not the only one who is excited that you are here tonight, right?
Okay.
Okay. Okay, it's my pleasure to be the host tonight. Yeah.
Yeah, thanks to MEDSOC for inviting me to be part of this session. Yeah, and thanks, Khai Siang, for hosting.
Okay, we can see some comments here. Hi, Doctor, from Casey.
Okay.
From Raymond. Hi, Dr. Nadia.
Hi, guys.
Okay. So, Doctor, are you ready? Let's start. Okay. Okay. From what I know, you moved to overseas after you have completed your secondary education in Petaling Jaya. Am I right? So, what makes you get into a medical career after that?
Okay. Sorry, I wish I could give you a very exciting, unique answer, but I think the main reason why I chose medicine as a career was primarily because of influence from my family, because both my parents were healthcare professionals and they were also academics as well. So growing up, I was always inspired by the work that they did and their dedication to their profession. So that was the reason. Not a very unique answer. Yeah.
Okay. You graduated from Ireland, right? So how was the medical school life in Ireland? How is it different from the medical school in Malaysia?
Yeah. Okay. So when I went over to Ireland to study medicine, I was actually only 18. Okay. So I would say that it was a pretty scary experience initially because I was thinking like, how am I going to survive overseas alone? Without family and friends, who I had grown up with. So that was actually a very scary experience initially. But thankfully, Irish people are very friendly. They're very welcoming, and they are really helpful. So my classmates in medical school really helped me to adapt pretty quickly to medical school life there. And I think overall my experience was really good. And I think the thing that I really liked about studying medicine in Ireland was that the lecturers and professors there, they really place a lot of importance on the Sodoto method. I don't know, are you familiar with that? Yeah, I know. So C1, Yeah, so Sodoto is basically see one, do one, teach one, So that was how I was taught. So
Ah.
all the practical and clinical skills that I was taught was actually taught to me using that method. So I was asked to observe a clinical skill being performed by a senior physician, and then I was basically encouraged to practice a few times doing it on my own, and then after encouraged by my lecturers to teach others how to perform that particular clinical skill. So, like inserting a
Mm.
unique catheter, taking bloods, inserting an NG tube, that was all taught to me using that method. So I thought that was really good. And I think it was a really effective way of, making me into a good doctor, especially a good intern, good, because they call house officers that interns, not HOs. And I think the
Okay.
other thing about med school there, that I think maybe slightly different from, I mean, I didn't go to med school here, so I can't really, make a fair comparison, but people are very chill and relaxed there, so people are not very, there's healthy competition, but people are not very super competitive. People are not, going to be like, oh, I'm going to be, I want to be the top student in the class this year, and that's like my target. And then, no one feels stressed. I think that there was a lot more focus on, social stuff, like so every other night there would be like a party like some gathering, and then,
Oh.
you have medical students as well as students from other faculties coming together to socialize. And I think at school, so you have a lot of social events, but in Ireland it was like every other day. So so it's like, I wonder when my classmates had time to study, but they did. Okay, so and I think the other thing about Ireland maybe that we can do better here is that it's a more open culture, and people don't really care about hierarchy. People don't care whether you're a medical student or
Mm.
everyone. I mean, they don't care about seniority. So everyone's voices, everyone's opinions are valued and respected, regardless whether you're just a medical student or a junior doctor. So I remember, like, after morning rounds, even when I was a medical student or a house officer, the specialists and consultants would, like, belanja is makan, and we go for coffee after morning rounds. And being Malaysian, right? Obviously, I look forward to free food lah. So so that was always like so I was like, oh, free coffee, free breakfast. Okay, great. So I totally laughed my consultants because of that. Okay. So yeah, but yeah. So I think when I returned to Malaysia, I think I remember telling myself that because of what I had experienced in Ireland, I must remember that if there's ever a day, that, if I had a team of doctors, that I know I want to inculcate that kind of culture of kindness and respect. Okay, because I think we all need to be kind and show respect to everyone, regardless, where they rank. Okay? Yeah.
Yeah, yeah.
Sorry, it's a very long answer. Sorry.
So, doctor, you completed your 2 years your internship in Ireland, right? After your medical school.
Yeah. So actually, in Ireland, and I think it's still the same now. The internship, the duration of internship in Ireland is actually only 1 year. It's only 1 year. So yes, so it's not 2 years like how it is here, and I think it's still 1 year. And so the problem is that when I came back, when I returned to Malaysia, I actually had to complete a few postings, to sort of complete my housemanship, because I wasn't able to do everything during that 1 year in Ireland. So I had to do my ONG, housemanship here as an MO. So that was a bit strange. Yeah, yeah.
So after your internship in Ireland, you started your postgraduate training in Malaysia, right? Why did you
Yeah,
decide to
so,
come back to Malaysia for your postgraduate training
yeah.
instead of staying there?
Yeah, I know. I get asked this question a lot from a lot of people. I think I could have stayed on. I think it was a dilemma that I faced. I think I sort of was like, I spent a lot of time thinking about whether I should stay on and specialize there or come back. I think there were definitely opportunities for me to specialize there. But because, I sort of already decided on doing medical microbiology, and infectious diseases are more prevalent in this part of the world. In the UK and US, of course, you have infections, but you don't see infections like dengue, you don't see infections like TB. So I would say this part of the world is the best place to actually do something like micro.
Okay. So this is the answer for why did you choose medical microbiology, right?
Yeah, 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 I guess. Yeah.
Yeah, a lot of people also ask, fill in the Google form and ask, why did you choose medical microbiology?
I guess
Okay,
the other
so
reason was because I met a very good clinical microbiologist when I was an intern in Ireland. She was working in my hospital, and I was doing orthopedics at that time, and the orthopedics are quite they're quite clueless, right, when it comes to
yeah.
infections and stuff. So I'm sorry, it was a bit controversial there, that comment, but so they will always be calling her, for advice about how to take samples for testing, what tests would be the right ones to diagnose infections. So I was like, wow, she knows a lot of things that my orthopedic consultant doesn't know. So I was like, oh, she's awesome. So, I think it'd be cool to be, a clinical microbiologist like her in the future. So I think, you will see, and I'm sure Khai Siang and everyone, else as is that, along your medical school journey, you will be like, oh, that consultant is so inspiring, or that specialist. And I think I want to choose this field because of them, right? So I think that's what happened to me as well. Yeah.
Yeah. So medical microbiology is very important. So in your own words, why medical microbiology is important?
Well, I mean, of course, I'm biased lah. I mean, I would say it's very important, but I think clinical microbiologists, we play a very critical role in the healthcare system, because our role is very diverse. We work very closely with the ID physician, so there's sometimes a bit of overlap between the role of a clinical microbiologist and an ID physician, but also very distinctive roles that we have lah. So we do a lot of, we receive a lot of consults from our colleagues in other specialties about, what tests, would be the right ones to diagnose an infection. We also determine whether a patient's infection is caused by antibiotic resistant bacteria. We introduce new tests for infectious diseases. We also work with the infection control team to prevent and control infectious disease outbreaks in the hospital. So we have, we do many things, and I think we do play a very critical role in the healthcare system. And I'm sure I'm sure many of you have seen that list that WHO came up with, the top 10 threats to global health. Khai Siang? Or anyone?
Not sure.
Actually, so six out of the 10 threats to global health, mentioned by WHO are actually infectious disease related, so like antimicrobial resistance, the rise of vaccine preventable infections, and come on, we are living during COVID now, right? So it's like we can always be threatened by a pandemic, and you need your ID physician, you need your clinical microbiologist during critical times like this. So I guess the other thing would be maybe a little bit of history. I mean, throughout history, there are many medical microbiologists that have made great discoveries in medicine. So we have Robert Koch, right? So Robert Koch,
yeah.
he won the Nobel Prize for his research in tuberculosis. And you have Alexander Fleming. He discovered penicillin and he won the Nobel Prize for that. And closer to home, we have Professor Chua Kobing. He was a professor of medical microbiology at my department in and he was the key microbiologist that discovered the Nipah virus, and he won the Merdeka Award for that. So if any of you, if you're interested, you choose micro as a specialty, you might end up being the next Nobel Prize or
Nobel Prize winner.
Yes, exactly. Because as I said, many discoveries in medicine were made by medical microbiologists.
Yeah. So as we know, the Department of Medical Microbiology in the hospital is a team that consists of many members, right? So each of them has their own roles to play so that the laboratory can function well. So, and at this moment of COVID-19, we also talk about sending the nasopharyngeal swab, the oropharyngeal swab to the lab. But we do not know who are in the lab actually. We just said send to the lab, send to the lab.
Yes,
so maybe you can tell us who are the people, the heroes in the department.
So obviously I'm one of them. Okay. So my department is a very unique one because we are actually split into two. So we have a Department of Medical Microbiology at the Faculty of Medicine and then we have the Department of Medical Microbiology at University of Malaya Medical Center. So that's at the hospital side. So the micro team at the hospital side basically consists of medical officers. We have specialists, we have consultants, we also have scientific officers, we also have laboratory technologists. So the only person we don't have is is a house officer lah. Okay, so we don't take in house officers. So the most junior doctor would be a medical officer. So at the moment we have 2 senior consultants, 2 junior consultants, we have 5 specialists, we have 2 service MOs, and we have 12 in-campus clinical masters, micro trainees doing their training. Yeah. So we all have our role to play lah. So yeah.
Like UMMC is a big hospital, so UMMC have this department of medical microbiology, we all know lah. But do all the government hospitals have the department of medical microbiology as well as clinical microbiologists?
Yeah, no, definitely not. We definitely do not have enough clinical microbiologists for the Ministry of Health to actually post one in every hospital. But I would say, the major tertiary hospitals like UMMC, which UMMC comes under the Ministry of Education or MOH. But if you're talking about Ministry of Health hospitals, hospitals like HSTAR, HKL, they would have a full-fledged medical microbiology unit. But the medical micro unit in MOH hospitals usually are parked under the pathology department. So they're usually not a separate unit or department. Yeah. And then you would, like, because I have students who have, undergone, they went through the training in UMMC, and then, a lot of them are now specialists in Ministry of Health hospitals. So you wouldn't see many, you will see like 1 or 2 in a hospital, and, and then sadly some, after 2 years, they quit and go into private practice. So then the hospital ends up not having any clinical microbiologists and waiting for the next one to come in. And that is a very junior specialist that is going there to do gazettement. So yeah, that's what it is lah. Yeah.
Yeah. So like I think a lot of people do not know what is a clinical microbiologist and what do they do in the hospital. So maybe you can describe what is a typical day like as a clinical microbiologist.
Okay.
What you do in the hospital.
Yeah. Okay. So I think I'll be talking from the perspective of a clinical academic, because I'm also a medical lecturer and researcher at the Faculty of Medicine UM. So in the morning, I could be busy giving classes to medical students, facilitating PBL. If it's not medical students, I'll be giving classes to other undergraduate students like dental students, biomedical science students as well. And then after I'm done with undergraduate teaching, I would usually have to teach my postgraduate students, so my clinical master students. And then mid-morning, that's when usually if I'm on duty for that week in the hospital, I will be discussing cases with my MOs, and then we will go through all the the cultural results for the day, and then we will interpret the results with the patient's clinical history, radiology findings and laboratory findings, and then we come up with a final infectious disease diagnosis. So that usually takes up my whole morning until afternoon, and then lunchtime. And then afternoon, usually I could be supervising a postgraduate CME, I could be attending a multidisciplinary ICU ward round, or I'll probably be busy doing research. And throughout the day, I will usually get a lot of phone calls or consults from my colleagues in different medical specialties, for advice and stuff like that. I mean, it's so, I could be teaching and then I get a phone call, and I'll be doing rounds, I get a phone call. So consults are like just throughout the whole day. So yeah.
I see. Do you have contacts with patients every day?
Yeah, so that's the thing. That's one thing unique about clinical microbiology in Malaysia. So if you're a clinical microbiologist in Malaysia, you don't actually have your own patients. So you're involved in patient management, but you do not have direct clinical responsibility for patients. So the kind of when we receive consults and we give advice on diagnosis and the management of infections, but advice and input to patient management can be done over the phone or in a multidisciplinary like ward round, like ICU ward rounds. So that's one thing unique about clinical microbiology, where we don't have, we don't directly manage patients. But all patients in the hospital will be like our patients, because infections can occur in all specialties.
So we'll be referred. So some of the cases, not only inpatient will be referred to you, even though outpatient also will be referred to
Yeah.
clinical
So if there are
microbiologists?
queries, for sure. Yeah, if there are queries, if they, if my colleagues in in other specialties, they don't understand the culture report, or they're not sure what tests to do to diagnose a particular infection, or or they require further testing, but they're not sure how to go around that, and sometimes they get a funny bacteria that grows in culture, and they're wondering what the heck is this thing? Okay, let's call the microbiologist and find out the clinical significance of it. So that's kind of like the consults that I get. And because tuberculosis is my expertise, I think I would say 70% of the consults I get are about TB and other types of microbacterial infections. So so that's basically what we do.
Do you have on calls?
Yeah, sadly. I think when I chose this skill, I was thinking, yay, no calls. But then my head of department at the time was Professor Zali, and he said, oh, you still have to do calls, But at the time I already registered for the program. I was like, only now you tell me. Oh, I have to do calls, is it? Okay. But no, but to be honest, the calls that clinical microbiologists do, traditionally they are a mix of active and passive. So which means that on the weekends, we have to go in to the hospital, especially now during COVID time. There are a lot of testing to be done, so we oversee the COVID PCR testing and make sure that the results are interpreted correctly and they go out. Okay, so definitely weekends are like active now. So my MOs definitely have to go in. Okay, so I do go in, but sometimes if it's a very senior medical officer and I trust their work, usually I come in on a Sunday lah. So Saturday I will relax today. I'm not bullying, I don't bully my MOs, but but then once we finish our work doing on call, like say on the weekend, we can actually go home and be on call from home. And we can actually take calls and give advice over the phone. But we might have to go back to the hospital again if there's an urgent case that cannot be dealt with over the phone. Yeah.
Okay. So just now you mentioned about in your team, you have clinical microbiologists, you have clinical microbiologist science officer, and so maybe you can talk about the differences between the clinical microbiologist and a clinical microbiologist scientist and an infectious disease physician. I think a lot of people confuse about this.
Sure.
Profession.
Yeah, okay. So like I said, my department is split into two. So the hospital side is the hospital side, but at the Department of Medical Microbiology at the Faculty of Medicine side, we also have colleagues who are scientists. So they are PhD holders. So their main job actually would be to do research in microbiology, but because they don't have a medical or MBBS degree and they have not undergone specialist training to be a medical microbiologist, they cannot practice as obviously they cannot practice as clinical microbiologists at UMMC. So their job is basically centered on research as well as on teaching. So I'm sure many of you here who are medical students, I mean, you would have encountered many of them. So many of them teach you as well. Yeah. But so that's our clinical. That's our microbiology scientist. So we don't call them clinical because clinical means that you have an MBBS degree. So you have your microbiology scientist, okay, and then you also and obviously ID physicians. And so a lot of people are confused sometimes about ID physicians, the clinical microbiology. So we actually work very closely together. I would say the ID team is the one that we talk to the most every day on a daily basis, really, because we require the input. They also require our input when it comes to managing patients with infections. So I think the main difference between ID physicians and clinical microbiologists would be that ID physicians obviously have their own patients. Okay, so clinical microbiologists, we don't have direct clinical responsibility for patients, but we give advice and input to our colleagues, and then based on the advice we give, they manage the patients. So that's the difference. And I think the other thing would be that so ID physicians, they are 100% based in the wards. They're not involved in the laboratory diagnosis of infectious diseases. So that's the clinical microbiologist territory. Okay, so we are very territorial with the ID physicians. No lah, but we love them, and I'm sure they love us. But sometimes it's a bit of sibling rivalry. with the ID doctor. No lah, no lah. But then just to add on that, if you want to specialize, subspecialize in ID, you would have to do posting in microbiology, because I think it's essential. You need to know how the lab works and what tests are there. If you want to be an ID physician. Yeah. But in the UK and in Australia, you can actually opt for this sort of hybrid training program, which allows you to qualify to be both an ID physician and a clinical microbiologist. But I would say people like that tend to be quite confused with their roles. They do not know, to be an ID physician or to be a microbiologist. So yeah.
Yeah. So that there's no clear-cut distinction between two. Both need to work together, right?
Yeah, we work very closely together, to be honest. Yeah, I think we rely a lot on each other. So for when it comes to management of patients with infections, for sure. Yeah.
So you mentioned just now that to be a clinical microbiologist, you need a medical degree, right?
Yes,
who else
for sure.
can be,
Yeah.
So you need an MBBS or MD to be a clinical microbiologist. So how to be what is the training pathway for clinical microbiologists to be a clinical microbiologist?
Okay, so
mainly in Malaysia. Yeah.
Mainly in Malaysia. Okay. Yeah, so I would say the majority of clinical microbiologists in Malaysia would have gone through the Master of Pathology program. So that's MPath. So the Master of Pathology program is the local clinical master's program for doctors who want to enroll. They want to enroll into it so that they can qualify to be clinical microbiologist. So the thing with the Master of Pathology program is that that's pretty much the only kind of option you have in Malaysia. There are no alternative or parallel training pathways at the moment in Malaysia, to be a clinical microbiologist. There are 5 universities that currently offer the program. So you have you have UKM, you have USM, you have UPM, you have UITM. So these are the 5 universities that are currently recognized by the Ministry of Health as specialist training centers for medical microbiology. Now, to enter into the program, requirement wise, like you mentioned, Khai Siang, you have to obviously have an MBBS degree for sure. You have to have obviously completed your housemanship, and then 1 year post registration. You have to have 1 year of clinical working experience post full registration. So that's a total of 3 years working experience before you can enter into the Master of Pathology program. Other requirements, you would obviously have to sit for the medical specialist pre-entrance exam. That's the MEDSOC. I don't know whether you're all familiar with that. So that is now controlled by the Majlis Peperiksaan Malaysia. Okay, so that's an annual. I think they have 2 exams a year. I think so. If you pass that with a minimum score, so you not only have to pass it, but you have to have a minimum score actually, and then you have fulfilled that 3 years clinical working experience. You're pretty much good to go lah. But if you are a MO is a bit complicated because you have to fulfill all the other requirements. You have to be permanently appointed in an MO position. You have to be confirmed in service. You can't be over 43 years old. And there are other rules that they have. If you're an MOH,
that is sponsored, right? Sponsored by the government.
Sorry, those are the requirements for you to apply for the HLP, the Hadiah Latihan Persekutuan. So because currently all the 12 MOs that are doing the training in my team now, they are not all, majority are actually HLP scholars under GPA. Yeah. So those are the requirements.
So is the exam you mentioned just now is MEDX, right? The MEDX exam, is it a general examination for all the specialty or just specific for medical microbiology or pathology?
Yeah. So because the Master of Pathology program so it's a 4-year program like all the other clinical masters program, but it's divided into 2 stages. So you have stage 1, you have stage 2. So because in stage 1, which is it's of 1 year, 1 year's duration, during that 1 year you actually not only have to do posting in medical microbiology, you also have to do posting in anatomical pathology, chemical pathology, hematology. And then after that, if you pass that first year, then you can do your advanced training in medical microbiology alone. So you can forget about the other disciplines. But because the first year involves posting in all these different disciplines, the MEDX pre-entrance exam actually tests you on all the pathology disciplines. So even say you want to do master of pathology because you want to be a clinical microbiologist, to pass that MEDEX exam, you need to also study the other disciplines like anatomical pathology, hematology, chemical pathology. So yeah, so there isn't like a paper just for medical microbiology, because that's how the program has been structured, that you have to go through training of all the disciplines before you do
I see.
medical microbiology. Yeah.
Okay. How about the MRC pathway? Do the Malaysian Medical Council accept the MRC pathway?
For
The
sure, for
UK
sure.
pathway.
So yes. So if you want to be a clinical microbiologist in Malaysia, and you can also do an overseas program like what Khai Siang mentioned. So that's the member slash fellow of the Royal College of Pathologists UK. So MRC path or FRC path. So that's the UK qualification. And you can also do the what's called the fellow of the Royal College Pathologists of Australia, so FRCPA, so the Australian qualification as well. So yes, but both of them are recognized, but at the moment, okay, but there might be other overseas qualifications that might be recognized in the future, additional ones. So like I said, if you want to be a clinical microbiologist or you want to be a specialist in any field, before you choose the program to take, okay, I mean, the local clinical master is always very safe lah. That one for sure will be recognized, right? But if you want to do an overseas program to qualify as a specialist, please go to the National Specialist Register of Malaysia website first, the NSR website, and check, okay? Please check which qualifications the foreign ones are actually recognized, because a lot of people, they don't read that and they go do some qualification somewhere and don't know which country, and then they come back and they cannot practice because they cannot be registered with the NSR. So it's very important now. If you're a specialist, you need to be registered with the NSR in Malaysia. So yes, MRC path recognized, the Australian one recognized as well. Yes.
So other than these two overseas certificate, there are only the only left is all the master program in Malaysia, right?
Yeah. So yes, there's also something called a diploma in clinical pathology. I'm not familiar with that, but I think I've seen that in the NSR list, and it's considered recognized postgraduate qualification. But I'm not too sure. I'm not very familiar about that qualification. So yes, you're right. So not that many options really. If you want to specialize in microbiology, those 3 or 4 qualifications, yeah, would be recognized.
I think let's talk about the master program in Malaysia. So
Sure.
how long is the training? You mentioned like part 1 and part 2. So how long is the training?
Yeah, so it's like any of the other local clinical masters program. So it's 4 years. And as I mentioned, it's divided into 2 stages, stage 1 and stage 2. So stage 1 is 1 year's duration. So candidates have to go through all the different pathology disciplines. So 10 weeks of posting in each discipline. So 10 weeks of microbiology, 10 weeks of anatomical pathology. Okay, and then there's an exam at the end of the first year, and the exam covers all the pathology disciplines. So if you pass that exam, you can move on to stage 2. So in stage 2, which is of 3 years duration, you will be doing advanced training in the discipline that you have chosen. So you've chosen micro, then for the last 3 years, it's just purely micro. You don't have to touch the other pathology disciplines anymore. Because I remember when I was in first year of my training, I had to do forensic pathology as well. I had to, cut up dead bodies, and I was like, no, I do not want to do this, but I had to do it as part of my training. And and then about that, I was like, oh, second year, thank God, I don't have to see any more dead bodies. I can just do like micro, and just see bacteria and viruses instead. More fun. Yeah, so and then at the and during your stage 2 of your studies, you also obviously have to do a research project lah. So and you have to submit a research report at the end. It's usually at the end of 3rd year, beginning of your 4th year, you really have to submit a research report. And then after that, you finish your 3 years of advanced training, and then you have the final exit professional examination, and that exam can be quite tough. And interestingly, is the host of the conjoined exams this year, and I'm actually the co-chairman of the exams in October, which I've been finding a very interesting experience organizing. It's a lot of work, but so it's a conjoined exam, meaning all the universities, the 5 universities, are involved in setting the questions and and in examining the students. Yeah.
I see. So, are there subspecialties for clinical microbiologists to further subspecialize in, like virology, bacteriology?
Yeah, sure. Yeah. So a lot of people are confused. Some people consider medical microbiology as a subspecialty of pathology, but it's not. It's actually a specialty, and then you can go on to subspecialize. So like what you had mentioned, Khai Siang, you can subspecialize in virology, in mycology, in whatever ology. Okay, so in the end,
Microbacteriology,
TB. Exactly. Yeah. So then you can call yourself, like say if you start specialize in virology, you can call yourself a clinical virologist. So you can. So those are recognized subspecialties within medical microbiology, and you can actually get NSR to recognize you as being a clinical virologist or whatever. So yeah, for sure. Yeah.
How to subspecialize? Is there any pathway?
Okay, so to subspecialize, so if you are a specialist in the Ministry of Health, so you can apply. I mean, the usual, you got paperwork, you got forms to fill in, but you can apply. But I think also dependent on the spots available every year. So they will also assess whether the subspecialty that you want to do is in demand. Is it something that is urgently needed at the moment? I mean, do we really need another clinical virologist? Okay, so obviously the people at the top makes all those decisions. But if there's a spot, then they will give you the spot, and you can apply to do it anywhere. So I had a colleague who did her subspecialty. I mean, she did her MPath, so she graduated as a clinical microbiologist, and then she wanted to do infection control. So she went to Geneva in Switzerland to WHO to learn and to subspecialize in infection control. I think she spent about a year there, I think. Then she came back, and now she's an actually infection control specialist, but her background is medical microbiology. So JPA, I mean, MH sponsored her to do that. For UM is different. If you are a lecturer with UM, you can also specialize, but that fund comes under the Ministry of Education, so a different fund, I guess. So the spots are separate from the Ministry of Health. Yeah. But sometimes
a question from the audience.
Oh, yeah, sure.
Yeah.
Sure.
You continue.
No, I was just saying that sometimes it's when you're in medicine, you study so much, right? So many years of studying, and then people will be like, "Do you want to specialize?" And you're like, "Oh my God, another year of studying. Never mind." Yeah, because I haven't specialized yet, So I was like, "Oh, okay, never mind." But it's good. It's good to start specialize. Yeah.
Okay, we have a question from the audience.
Okay.
Mirza. So, Dr. Nadia, under UM Master of Pathology, do you apply directly to study one of the specific subspecialty, hematology and anatomy pathology, and then B, or do you make a choice or can opt to choose another subspecialty at the end of your first year?
Okay. So if you are applying to do the Master of Pathology program as a Ministry of Health MO medical officer, usually Ministry of Health would ask you already, before they give you that letter or whatever and they will actually ask you which discipline, I mean which specialty you want to do, So after you pass your stage 1 exam, do you want to do micro? Do you want to do hematopathology, for example? So you really have to make that decision. But I have, in my experience, I've had students who decide to switch after they pass their part 1 because, they realize that I really hate microbiology, and they'll be like, I don't like it. I want to do like forensic pathology. Like I prefer dead bodies than bacteria. Okay, so so you get students like that, and then what you do is they will appeal to the Ministry of Health, and then if they feel that okay lah, no issues, I think we do need another forensic pathologist. So you can switch, yeah, for sure. But I think it's better to make up your mind before, like, if possible, you know. But there's always that option to change for sure. Yeah.
Okay. Okay, I see a lot of people asking this in the Google form. This question. As a lecturer in the faculty and a consultant in UMMC as well as UMSC, how do you balance your work and your personal life? Your work-life balance.
That's probably, I think that's the toughest question so far. You know what? I think I really struggle like everyone else who has a very demanding job. I think medicine is a very demanding profession, regardless what specialty you choose. In the end, medicine overall is a very demanding profession, and and if you are also doing academia, you're also doing lecturing, you're also doing research, it adds on to the stress of course. So I think it's very difficult, actually, I would say, to maintain work-life balance. I mean, I've been a clinical academic for 7 years now, and I'm still finding a way to be like, come, I still can only get 3 hours of sleep every day, like, I do get those moments. But I think what helps me is I really like this to-do list apps, those apps you can download, and you can put in, okay, I'm supposed to do this on Monday, and then check it off or whatever, and then they give you like stars or points if you manage to complete 5 tasks in a day. So that's like that's quite fun. So that kind of helps me keep focused and task oriented, and I think you have to be very good at multitasking. So I'm I think quite good now. So I'll sometimes my multitasking will fail lah. I mean, but I do my best so that when it's 6 p.m. or 7 p.m. I do not want to work anymore. I do not want to look at exam questions, exam papers. I don't look at my research. I'm so sick already. So I just want to watch like Netflix 24 hours, or I want to sleep the whole day or something like that. Okay. So and I think it's important that you also maintain your relationship with your with your relatives. You make sure that you set time to meet your friends. Because otherwise, I went through a period where, I didn't talk to my friends or family for I think a month, and people were like, "Are you dead? Like, are you still alive?" Okay, because I was just so busy, and I didn't have time to talk to anyone. But I think, for most of you, medical students, I think it's probably like that as well, right? I think I remember when I was a medical student, you're just so busy, right? But I think you really need to make time, because you cannot be married to your job. Okay, your job will never love you as much as you love your job. So the only people who will love you as much as you love them is your parents, your relatives, your spouse, your friends. So you need to invest time in those sort of relationships. Okay, yeah. So really consciously set time to spend time with family and friends.
Okay. So here's another question. Hi, Dr. Nadia. Being a medical lecturer and researcher on top of being a medical microbiologist is no doubt tiring and stressful. However, you have always shown a very cheerful, helpful, and kind side to everyone. What do you do to keep yourself constantly happy?
Who asked that question?
I don't know. It's anonymous.
Oh, no, anonymous. You know what? I think you have to love what you do. I mean, without a doubt, my job is quite demanding, but I think I like my job. I mean, not all aspects of my job I like. I think the teaching part is what I really like to do, and I think that gives me a lot of energy. When I teach, I get a lot of energy from students as well, and I think that keeps me happy because I'm doing what I love. Okay, so I think if you have a job where you really actually you wake up in the morning thinking that I really do not want to go to work, I think it's time to switch careers. So I haven't gotten to that stage yet. I still love my job. Okay, I'm not trying to. I mean, I do not know. Maybe one day I'll be like, I really do not want to get out from bed and go to work. Okay, so I think that will be the day when I'll be like, okay, time to look for a new job. So, but so far, I wake up every morning and I'm feeling enthusiastic to go to work. So yeah. So just love what you do, basically. Yeah.
Yeah, love what you do, whatever you love to do.
Yes, exactly. Whatever it is. Yeah.
Yeah. Okay.
I wonder who asked that question. Okay, that was anonymous.
No, I don't know who asked the question, but yeah, it's anonymous.
Anonymous. Okay, all right, no worries.
Okay, so next question. What are the challenges you face as a clinical microbiologist in general before COVID-19, as well as at this moment of COVID-19? Any interesting stories to share?
Okay, well, I think pre-COVID, during COVID, and hopefully when we reach the post-COVID era, which I do not know, if we ever get there, I mean, there are all this, a lot of talk about vaccines and stuff, the Sputnik vaccine or whatever it is. I don't think that's any good, but, but I think regardless, whether it's pre-COVID, during COVID, or post-COVID, I think the biggest challenge that I will always face is juggling the three roles I have, as a clinician, as a teacher, and as a researcher. That's always a challenge for me, I think. But a challenge specifically related to the COVID pandemic, I think probably, to be honest, since February, March, and until probably the end of May, June, right? When things died down a bit, I think it was quite difficult for my team, to be honest. I think we were really under a lot of pressure. A&E, micro, ID, chest. These were like the main teams, really. Infection control as well, that were really at the forefront of battling the pandemic, So and there was a few months where the Ministry of Health actually reached out to UMMC and other university hospitals to help them with testing because they couldn't cope anymore. So we were actually, helping MOH with nationwide COVID PCR testing. So we were actually testing up to 600 cases a day. So that was a crazy, 2-3 months where my team was under a lot of pressure. And I think some people broke down, some people were so tired. But I think we have passed that stage. Of course, the worry is always about the second or third wave, and hopefully we never really reach that. But yeah, so that was a challenge for me. I think not only for myself, but I think I was really concerned about the other people in my team, especially the junior ones. They were really tired actually. But luckily you have to get through things together. It's all about teamwork, and I think I have a very good team. We just have to support each other during times like this. Anything interesting? I think probably the most interesting thing during COVID would be that I was the clinical microbiologist that diagnosed the first COVID case in UMMC. So that's the Malaysia 23rd case. So that was me, guys. So a lot of people joke and say like, oh, Dr. Nadia, that report that you have, you should go and frame it, and be like, the microbiologist that diagnosed the first UMMC case. I just like, oh, come on, it's not that great. It's like, so yeah. So because why? When the pandemic started in November, December in China, right? A lot of countries were like, very laid back. I'm not going to come to our country. But then, in January, you started seeing cases pop up in other places. So we were all already ready with the test and everything. And then, but it was very quiet, January, very quiet, and then, and because we go on call on a weekly basis, so you have an MO and a specialist on call for a particular week, and it's the same pair for that week. So very quiet, so, and then suddenly, boom, I come and do on call in February, last week of February, and suddenly, Dr. Nadia, can you come and check this result? And I'd be like, what? It's positive. So everyone was like, you come, you do your call, and then we get a positive case. It's been so quiet all this while. so that was interesting. Yeah. So
hopefully it passed the COVID things already.
Yeah,
so
I know.
You guys
Hopefully
now are quite okay already.
Yeah, it's true. Yeah, I think
Thank you very
Malaysia,
much.
I know. Yeah, I mean, I think, we really pulled together, as a nation. I think we've done very well, I think, yeah, compared to other countries. Lah. We can do better, lah. We can do better. So everyone, please wear your mask. Okay, wash your hands.
Social
Yeah.
distancing.
Social distancing, yeah, social distancing.
Yeah.
Yeah.
Okay. So the next question. What are the future challenges and future demands for this specialty? Is this career competitive?
Okay. So, okay, I will answer that bit about, about whether it's competitive. So I think medical microbiology is becoming increasingly competitive. I think there are many junior doctors now who are aware, that there is such a specialty. Because to be honest, when I was a medical student as well, I didn't know that you can actually specialize in medical microbiology. I thought that you have to be a cardiologist, endocrinologist. So I didn't know that there was an option until I came back to Malaysia. But now I can see there are a lot of junior doctors that they will reach out to me. They will actually, they will message me, to Facebook me, or they get my contact from someone, and they'll ask me, oh, how do I become a clinical microbiologist? So there's a lot more interest. But because there's more interest, you will then see a lot more people applying, to enroll into the program. So that makes it become more competitive every year, because you see a higher number of applicants, for the program. But I think MOH does recognize that it's important to train more clinical microbiologists. So hopefully there'll be more training spots available in the future, or maybe we might have an alternative or parallel training pathway. So another option to become a clinical microbiologist in Malaysia. So yeah, When the other question was what? Yeah, Kai Siang, sorry, competitive or challenges is it
Challenges.
in the future?
Yeah.
Yeah, I think the challenge really for clinical microbiologists in the future is the rise in artificial intelligence, automation, big data. I think the challenge would be for because right now we actually have robots that can actually perform gram stain and interpret gram stain. So we already have all those robotics. Yeah, we do. So I think the challenge would be to how do we actually utilize artificial intelligence, big data, robotics, automation, utilize it and integrate it into our practice so that we can improve the diagnosis of infectious diseases. Because there are some people, when they hear artificial intelligence, they'll be like, what? No, I don't want to know anything about that. That sounds weird. Okay. So, but I think it's time to move. We have to move with times. We have to be advanced in the way we approach our specialty. So I think AI is a big thing now, and I think our juniors have to be to really train up in that. Yeah.
Okay. We have another question from the audience. Hi, Dr. Nadia. I have a question regarding the subspecialization in clinical microbiology. For example, if someone is already a clinical microbiologist and wish to proceed to be a subspecialist in parasitic field, is it possible? And if can, how can I do so? It's from Akila Plus.
Hi, Akila. Okay. Yes, for sure. I think you know what. I think to be honest, I can speak for my department at UMMC. What we're lacking actually is well, maybe we might. It's not really. I mean, that's probably not really the title, but yeah, okay, a clinical parasitologist. That's what Akila was asking, right? About clinical parasitology. Yeah. Yes. So yes, actually, that's what we are really lacking, because parasitology actually is a component. It's actually something that we train in and we are tested in for in the exams, in the master pathology exams. But somehow, once you practice as a clinical microbiologist, especially UMMC, you don't really do any more diagnostics really in parasitology, because that's taken up by the Department of Parasitology, which is a separate department in the Faculty of Medicine. So we there are parasitologists there, okay. But I think the issue is that you cannot call yourself a clinical parasitologist if you didn't do the Master of Pathology program and you are not recognized by NSR. So yes, definitely you can. Parasitology is definitely a very important subspecialty in a way under medical microbiology. So you can be recognized as an expert in parasitology if you're a clinical microbiologist. So how do you do that? Okay, so how do you do that? Okay, obviously you have to do the master pathology program, and then after that, what you can do is you can apply for your sub kepakaran, or you can apply for subspecialty training in parasitology, but you have to look for a very good center, a very good parasitology center. It can be anywhere in the world, okay, and get trained up. You know, I mean, you can even do it locally, and I think it's about 9 months or a year, and then you can apply to NSR to be recognized. Yeah, for sure.
I see. Okay. Okay, another question. Is a clinical microbiologist a pathologist? Do you need to do pathologist work when the hospital is lacking staff? Like you go
Okay,
to
so the
forensic
second
again?
question, I think the second question I have to be a bit careful. um, okay, so the first question, yeah, I mean, yes. Okay, so some confusion again. So yeah, because clinical microbiology or medical microbiology is a discipline under pathology. Okay, so that's why it's called master pathology program. Okay, so yes, so some people would prefer to be known as a pathologist, and then in brackets they put medical microbiology. So sometimes I've been asked to do that because I'm actually a pathologist, but in brackets medical microbiology. But I'm not very comfortable to do that. Actually, you know why? Because if someone sees your title that you're a pathologist, okay, even though that's what your institution wants you to put on your stamp or whatever, that means that you can also do that you can actually, look at bone marrow slides, look at histopathology. I mean, I did all that when I was in first year, but that was just first year lah. I mean, I really couldn't, for the life of me, remember, how to look at the bone marrow slide. So I don't think I want to call myself as a pathologist, because that means you're a general pathologist. You can do everything.
Yeah.
But if you are in the Ministry of Health, you might be expected to cover all pathology disciplines. Okay, so even you say you graduated as a hematopathologist, but you are in a Ministry of Health hospital, you are the pathologist there. So there in Ministry of Health, you are a pathologist. So you have to cover everything. So even though you might have forgotten, what is RPR, because you
Just
you
1 year
didn't
training, then you can do all the
your
things.
micro, right? I mean, you really have to remember what you learned lah in first year. So that's why I'm pretty happy that I get to just do micro and not cover the other disciplines. I mean, we're quite tough lah. I mean, I wouldn't remember how to cut up a dead body. Seriously. I mean, next time would you trust me to cut up a dead body?
Can lah. Better than
Or
me.
look at the bone marrow side, diagnose multiple myeloma, you diagnose it as something else. So yeah.
Okay. Other than working in Ministry of Health hospital and universities, is there any other places that a clinical microbiologist can work in?
Yeah, for sure. So okay, so again, like I said, I don't know whether I mentioned this, but there are different routes that you can take to enter the master pathology program. So I think when choosing the route, you must carefully consider your options, okay? Because the route you take depends on where you think you want to end up working as a clinical microbiologist. So if you think you want to work in the Ministry of Health and you want to work until you retire in the Ministry of Health, then you should apply as a Ministry of Health MO, get the HLP scholarship, and then enter into the master's program. But if you want to be, say, a clinical academic and also practice as a clinical microbiologist like me, the easiest route to take is to enter into a trainee lecturer program. So if you enter into a trainee lecturer program, then you finish your master's, you are automatically employed as a lecturer with the Faculty of Medicine, and as well as a clinical microbiologist at a hospital that faculty is affiliated with. Okay, so you can work in a Ministry of Health public hospital, you can work in the university hospital, you can also work in a private hospital. So Pantai, Sunway, many hospitals now have clinical microbiologists, but because it's hard to get someone to work with them full time, what these private hospitals do is they actually employ a clinical microbiologist working in a Ministry of Health hospital or in a university hospital. So I have colleagues in my department who are actually consultant clinical microbiologists at private hospitals as well. Okay, so I guess another way to earn money, if money is your thing, You can also do that. So yeah, you can. Private hospitals, private laboratories that just do testing, you can also. Where else can you work? You can also just, if you want, you can just be a medical lecturer. If you want to, like places like Monash University, there are clinical microbiologists who did empath, but they probably didn't want to practice being a specialist, so they just want to teach. So they are just lecturers in microbiology at Monash. So there are many options actually. So yeah.
I see. Is there a difference between working as a clinical microbiologist in the public sector and private sector in terms of workload, stress, working hour, salary, and etc.?
Okay, I don't need to comment about salary lah. I mean,
Okay.
salary, of course. I mean, any field as well. I mean, any field, you work in the private sector, of course, the salary would be better. But I think one good thing about working in a university hospital like UMMC, you have UMSC. Okay, so if you think you want a little bit more money, then you can also do your consultant work at UMSC. But so salary, I mean, that's always going to be more in the private sector. Workload, stress, working hours. Yeah, I think workload probably less in the private sector. So if say you are a microbiologist at say what's Tropicana Hospital is, what's the new name of Tropicana?
Is it SJMC?
Yeah, I can't remember the name. It used to be Tropicana Hospital, okay, or Sunway Medical Center. If you're a microbiologist there, I think that obviously it would have quite a bit of workload, but it wouldn't be as high, I think, as the public sector, because a lot of these private hospitals, their laboratories are not as huge as say like as the laboratory in UMMC, the microbiology laboratory UMMC. So they might do a few tests, but other tests they actually have to outsource to us. So that's why in my practice, in what I do every day, I also have to also oversee the testing of specimens or cases that come from private hospitals as well. Even though they have a microbiologist there, but they can't do certain things because their lab is not fully equipped. So that's why I think maybe it's a bit more relaxed there, I guess, in private sector. Working hours, but I think private sector is hard because one thing hard is that there's a lot of pressure to make money. There's always a lot of pressure to make money for your institution, because it's private lah. In public, of course, now UMMC is trying to be autonomous. I mean, they need to make money, they need to generate money, but there's more emphasis on whether you teach well, whether you do service well. There's more emphasis on that rather than making money. Okay, so it depends on what kind of stress you want. Stress from having to make more money for your institution, or stress from having to teach so many students, or stress from having to do research. So it depends lah. You can choose which stress you want. So then yeah.
Okay. The next question. After the housemanship, how can I join UMMC Department of Medical Microbiology to be an MO? Do MOs in UMMC get more opportunity to pursue the master program?
Oh, okay. How can I join? Okay, how can I join? Yeah. So I'm not only talking about micro, but every clinical department in UMMC, if there's a shortage, then there will be a vacancy lah. So the hospital will actually advertise, on their Facebook page or on their website that there's a vacancy in this department. So like for microbiology at the moment we have three service MO posts. So 2 have been taken up. One is actually vacant because the MO just left. So again, so it depends. So we do have posts, but whether it's vacant or not, like at the time that you want to apply. Okay, so I think it's always good if you're interested to apply for an MO post in any clinical departments in UMMC. Always check the website, always check the Facebook page, or you can go into the MO recruitment system and you can check for vacancies. And so that's the way, and then you contact HR at UMMC, and then they will tell you whether to confirm that there's a post, and then all the paperwork that you have to fill in. Okay. So do MOs in UMMC get more opportunity? opportunities to pursue the master's program? Okay. In a way, yes, because you see, when I mean, I cannot speak for the hospital, but for when UMMC, when a university hospital takes someone in as a service MO, it's with a long-term plan, for you. That means you're going to be a service MO so that you can gain some experience in that field. And if you're interested in that field, okay, we will sponsor you to do the specialist training or master's program, because that's what they have in their head when they are interviewing you. They see that you have long-term potential, so they're going to take you in, and they hope that you will like that field, and you will apply to do the clinical masters, and they will sponsor you to do the training. Okay, so they're not taking people in and thinking that this person will quit in 2 years' time. They want that person to stay. So for you to stay, takkan you want to be chronic MO, right? I mean, there's nothing wrong. But what I'm saying is, I'm taking from the perspective of a hospital at UMMC that we want people long term. So for sure. So for example, if you want an example, I had an MO who's now a specialist. So she was a service MO in my department for 3 years, and then she applied to UMMC for a scholarship. So she passed her entrance exam, pre-entrance exam, and then UMMC said, "Great, you passed. Okay. You fulfill all the other requirements, so we will sponsor you." So she graduated last year, and she's now a specialist in micro in UMMC. But because she's not also employed by the Faculty of Medicine, she doesn't have to do teaching, she doesn't have to do research like me. She's purely just service. So to answer that question, yeah, in a way. I mean, if you are a service MO, you know that the hospital got long-term plans for you, they just don't want to leave you like that. They want you to be a specialist in the end.
I see. We have one question from Cal. Oh, yes.
Okay, yeah.
Yes. Yes,
Doctor. New drugs. This one is a different webinar now. No.
This question.
Okay.
Yeah, from Calvin. While COVID-19 is the major concerning issue for now, the post-antibiotics era is equally worrisome but often downplayed. The loose usage of antibiotics with growing multi-resistant organism is there. And is there any drug in the pipeline aside from polymyxin and colistin?
Yeah, definitely there are. There are a lot of upcoming antibiotics to treat multi-drug resistant infections, and in fact, there is currently 2 trials ongoing under Pfizer, looking into new antibiotics, game-changing antibiotics, and the clinical trials, which I'm also involved in with the ID team. So, but you have to forgive me, because that trial was supposed to start 2 years ago and hasn't started yet, and then COVID came and all that. And actually, I can't remember the name of the antibiotic. It's a beta-lactam inhibitor. Calvin, I will confirm that and I'll message you later. But yeah, so that is a trial that will start soon. It's been postponed, delayed for about a year and a plus. Yeah, but so there are new antibiotics, but again, clinical trials are very important. You want to make sure that the drugs work, right? I mean, not only it works in the lab, but it actually works on real humans. So yeah.
Okay.
Sorry, Calvin, I think I didn't answer your question. Okay.
So next, how to be a lecturer? Is there any trainee lecturer program? Yeah, Doctor mentioned just now the training program.
Oh, you want me to
how to be
elaborate?
Yeah.
Elaborate. Okay.
Elaborate.
Yeah. So again, I think the easiest route really, if you really think clinical academic is for you, you really, you like to teach, you like to do research as well as practice, in your field. I think look out for trainee lecturer programs. They are offered by many universities actually, but of course sometimes the spots are limited. Okay, that's the reality of it, lah. But especially, but if it's a very in demand specialty, then for sure there will that university will offer this sort of training lecture programs. So they are usually advertised on the university's main page, or sometimes they're advertised in newspapers. Okay, so this trainee lecturer program, so you can actually just check that on the web page or in the newspapers. Okay, or what you can do is, a lot of people, what they do is they actually contact the head of the department, for that particular specialty that they're interested in, and ask them, is there a vacancy for trainee lecturer, for the trainee lecturer program in your department? And then sometimes the head of department wouldn't know lah, but then they will say that, yeah, we actually need someone to train, to train now to be a specialist in 4 years time and to be a lecturer. So then they will talk to the dean, they will everything, and then they'll be like, okay, we should offer a trainee lecturer spot. So I think be proactive. Sometimes you don't have to wait for advertisement. You go and contact that particular person and you ask them, is there any possibility? Can I join your department as a trainee lecturer? Because that's the route I took. So I was lucky because when I came back to Malaysia, the Department of Medical Microbiology was mainly clinical, were mainly consisted of scientists, PhD scientists. So they needed clinical microbiologists. So there were very few. So they needed to train younger ones. So I think I came at the right time where they were saying, oh, okay, do you want to, because you know why? When I accepted that trainee lecturer spot in medical microbiology, like that was about a decade ago, the head of department told me at the time, Prof. Sazali, he told me that, I've been advertising this for 2 years. And no one actually wants to take up micro. So I think because not such a popular specialty, right? I mean, a lot of people also don't even know that it's a specialty. So, and then he was like, oh, and then you came, and then after that someone else also wanted to join. So they were happy that they got medically qualified people to join the program. So yeah, so do look out for advertisements, and then be proactive, reach out to the head of department for that particular specialty you're interested in, and ask him or her, is there a possibility to join as a trainee lecturer?
Okay, I see. So we got a question from the Google form. Hi, doctor. What inspires you to be an academician and dedicated teacher to students despite your busy clinical work?
Okay. So I think, like I mentioned, I think I have 3 different roles in my job, but I think teaching is what I like to do the most, and it's just what I love to do. I'm passionate about it, and I think I think Khai Siang will know, when you train students and then they go for competitions, and or like they do research under you and then they do very well, it's always such a great feeling as a teacher actually when you see your students excel, and I think I get a lot of energy from students as well. And I think the other thing I would say is that when I was a student in Ireland, I had really, really, really great teachers and professors. They were so kind to me. They would actually be like, oh, Nadia, you look free now. Can I teach you something? Is there something you want to ask me? And I'd be like, oh, okay. So, people were really, they were really good teachers. They were very kind as well. So I was thinking, when I return, I want, if I ever become a teacher myself, I want to be that kind of teacher. I don't want to be the muka masam teacher. Sometimes I can be grumpy. I mean, I can have temper, but generally, I think I am. Yeah, I get a lot of energy from teaching and from students. So I think that keeps me happy. and food and coffee keeps me happy as well. Yeah.
Food and coffee.
Food and coffee. So I think a lot of students know that. They always like, why doctor, I get coffee for you? And oh, okay, you make me doctor. You get happier now.
Okay, the next one. Could you share what was one of the most rewarding memories in your career as a medical microbiologist that made you glad you choose this field?
Most rewarding. Yeah, teaching. I guess when I was training students for the microbiology competition in Bangkok, and I think Khai Siang mentioned that it's called the SIMPIC competition. So it's a huge international microbiology, immunology, and parasitology competition in Thailand. So I think when we improved every year, we actually our performance actually improved every year. I think that was such a great feeling, and we ended up in the semifinals for 2 years in a row. 2 teams in the semifinals last year. So I think as a teacher, teaching medical microbiology to students, especially undergraduates. I think for me that was like, the sort of like the highlight of my career. I was like, oh wow, we have a team in the semifinals, so top 10 out of like 60. Is it 60 teams or something, right? Yeah.
More than
Yeah.
60.
Yeah, more than
Yeah.
60. More than, yes. Okay. Yeah.
All over the world. We are top 10.
I think probably the other thing, if it's not teaching, probably I think maybe something I was quite proud of. It was a team, obviously a team effort. It was a collaboration. When last year, when there was a research that I did with Thailand and US, and we got it published in a Nature journal, scientific reports. I think that was like sort of like, wow, okay, this is amazing, But I think that goes to show that to do incredible things, you have to work in teams. You can never really be successful doing things on your own, really. So I think that was one thing that I really learned, that you have to collaborate, work with people, and you can achieve great things. Yeah.
Okay. We have another question. In your opinion, doctor, why should someone choose microbiology over other specialties? Thank you.
Okay. I think something that I tell people to attract people. I think the first thing I would say is it's a demanding profession, but the work-life balance, compared to the work-life balance, other specialties, obviously the work-life balance is better lah. I mean, it's being a clinical microbiologist is not as hectic as being a surgeon, for sure. You still can have a life, okay, but again, you have to make sure you consciously set time to do other things that are not work related, okay. So work-life balance, I would say, definitely better than other specialties like surgery, okay, for sure. I guess the other thing would be that in what I find interesting about my job, which I enjoy, is that I get to interact and communicate with colleagues from across all the different specialties. So, and I think there are not many specialties where you get to interact with colleagues from other specialties, like a lot. For example, if you're doing I'm not going to mention, I won't mention, okay, but in micro, because infections can occur in any patient population. So it could be patients in the geriatrics ward, patients in the orthopedics ward. So like I remember last week there was a whole day where I got consults from the nephrologist, the orthopedic surgeon, the general surgeon, the respiratory physician. So you get to communicate with many different specialists and consultants from different fields. So that's something that I like, because you get a lot, you learn a lot more when you interact and discuss things with people. So I feel I learn a lot from talking to them as well when we're discussing cases. Yeah.
Okay. Hi, Dr. Nadia. Clinical immunology isn't featured in the NSR website as a specialty, but in many other countries it is. Do you see it coming to Malaysia soon?
Yeah, okay, so that's a little bit surprising to me, actually, because we do have we actually have a need for clinical immunologists. Okay, so when I mean clinical, is someone with an MBBS degree and actually did master of pathology. Okay, but I have no idea why immunology is not listed in the NSR website. And if I'm not mistaken, there was someone recently who did MPath and then did immunology somewhere else, but yeah, and couldn't be recognized by the NSR, and she couldn't call herself a clinical immunologist. So I think that's something that the NSR committee needs to look at. So I do not know, is it a case-to-case basis where it's not in the website, but if you apply and you have a specific qualification, you did your immunology training in the US or something, then they will recognize you? I do not know, but we definitely need clinical immunologists. Prof. Adiba, actually, I've heard her many times mentioning, we need clinical immunology, because immunology, I feel like, yes, if you're just an immunologist, yes, you're doing research, right? You can teach, immunology theoretically, but if you can't, if you don't have a medical background, you can't apply it clinically. I think a bit difficult, to be honest. So we actually need clinical immunologists in the hospital for sure. So we don't have. So at the moment, it's just us that we clinical immunology in the sense of when it comes to infectious diseases like dengue serology, that's immunology, right? So that's basically the microbiologists that are interpreting those test results. But we need someone very dedicated, I think. Yeah. So I'm sorry, I do not know the answer to that question. I hope that they will recognize it and they will put it in the list. Yeah.
Okay. Can a clinical microbiologist be a part-time GP in a private clinic and prescribe medications?
So this is someone who's looking for extra money everywhere else. Not enough money, yes, my coach have to go. Yes, for sure. I have a colleague who does she does locum at a private GP clinic. I have an MO as well, who does locum as well. But I think the main thing is that you must be careful wherever you work. Okay, if you plan to work in another place, okay, you have to ask the permission from your head of department. And if you work in a hospital, the director as well has to approve. So you can't just simply go and work somewhere. You have to actually get permission. But yeah, of course. I mean, we can, because we're specialists, we can prescribe. We can prescribe for sure. We can do locum. I mean, I could do that as well, but I'm be like, no lah. I mean, I'm not going to do that. I think during my free time, I'm just going to relax, sleep, and eat, drink coffee. So yeah, but yeah, for sure can. Yeah.
Okay. Here, okay. This is a question from Raymond. Doctor, what would you say are some of the major ongoing challenges that you face in your specialty, academic or clinical? And what future changes would you like to see towards overcoming said challenges?
Okay. I think challenges, clinical, I think really making sure that I have that we have good juniors coming up and training to be clinical microbiologists to take over our case one day. I think that's kind of like my worry, because at the moment I'm heading the diagnostic tuberculosis unit, but I haven't actually found someone who's going to be the one to replace me in the future. I mean, I think I'm still relatively young. Okay, so hopefully I don't drop dead anytime soon. But I think we always need to look into the future. That who is going to be the one to replace you, or you say you want to go, like I want to go on sabbatical now for 9 months, but I'd be like, who can replace me? Silence, right? Because no one. So I'll be like, okay, so then I go for sabbatical, but overseas I will also try and hit my lab. Is it? So I mean, it's very difficult. So I think that's a major challenge for me, looking for someone to be like a substitute or to replace me if I ever need it. What was the other question? Academic. Okay, challenges. Okay. Yeah, I think for me, academic wise, is the pressure to publish lah. Research is not easy. Research is not easy.
KPI.
I think for some people actually feel teaching is more of a challenge than research, because you know why? They don't like teaching. So so it's the opposite, because teaching is like, it's okay for me lah. I don't find it stressful. I find it fun. But research is like, I don't know how to describe it. It's like you really have to tell yourself,
more work.
I really like it, so I'm going to really write a paper this year. Okay, so that's and the other one was future challenges. Is it? What was the other one? I don't know. Future changes we would like to see towards overcoming said challenges. Oh, okay, yeah. Oh, very good question, Raymond. Thanks for the question. For the questions. Yeah, I think how to overcome all this is basically like, for research, I think we really have to make sure we have more time to do research. If there's a lot of pressure to publish research, to publish papers, then you have to be given more time to do research. Okay, so it would help if you have more people in your team so if you have more people in your team, then the workload would be nicely distributed. So you can also focus on teaching, you can also focus on research. Okay, so that's one thing. And the other one would be for clinical. What did I say for clinical? I remember what was the challenge? Oh yeah. Making sure that there are juniors who get trained up and can replace you one day. Yeah, I think for me, right, I feel it's sometimes very difficult. You have people, they come to you and they say, "Oh, I'm very interested in your field," but sometimes you really wonder whether they're interested or not, or because UMMC is very close to their house, so so you do not really know sometimes, but is you have to go with your gut feeling and in your instincts, and I feel I think for me, like, if we ever take in any new junior doctors into our team, there will be someone who really likes to do micro and not for any other reasons, because they think it's very flexible and can have at 2 o'clock already finish work, can go to the cafe and have coffee or something. Okay, so I mean, we do not want people like that. We want people who really genuinely like micro. Okay, so yeah.
This question is for the fresh medical graduates who are waiting for their housemanship now and interested to join the Department of Medical Microbiology in future. Are there any opportunity for them now, either at UMMC or Faculty of Medicine?
For the fresh medical, sorry, Kasa, can you put that up again?
FOM. Sorry. Okay. Here.
Waiting for the husband, interested to join. Oh, okay. Are there any options for them now? Either opportunities for them now or now? Oh,
Yeah.
okay.
Yeah,
to really prepare, is it? Or for the future?
Or maybe
okay.
like something like research assistant or other jobs for them?
Yeah, for sure. I mean, actually, I just took in one of the fresh medical graduates. She's coming in as my RE in September. So yeah, I always look out for. I mean, I personally, but I think I'm the type. I'm always open to people coming to me and asking me, "Oh, do you have a project that I can do as an RA?" And I'm very open to that. But I think I'm sure all of you know, everyone understands that money is always an issue. So to employ an RA, you either need a grant or you have to use your own personal funds sometimes to pay RAs.
Yeah.
Okay. So, but there are always opportunities, and I think now there's quite a good initiative. There is actually from the faculty, where they are asking lecturers to fill in a form to say that we have a project and we need RAs, and they're actually going to send that list, I think, to the fresh medical graduates. So to see if there's anyone that wants to be an RA with a particular lecturer on a project. So, but for microbiology itself, yeah, for sure. I mean, again, any of you just contact me. You can ask me. I mean, it doesn't have to be me. Maybe it's with another lecturer in my department. If you're interested in microbiology, it can be anyone. So you can always message me or whatever lah. You can personally message me, and I can give you further tips. Yeah.
Okay. We have one question from a pre-med student, Muhammad Daniel.
Pre-med?
How to manage time well? Yeah. How to
Pre-med
manage time well, and pre-med means before medical school. I'm not sure because he filled in pre-med. So okay.
Okay, that's good. Okay.
Yeah. How to manage the time well and actively involved in both curricular and extracurricular activities. I think he's coming to UM soon.
Oh, is it? Oh, okay.
Yeah.
I don't know whether
I think so.
I'm really the best person to answer this, because extracurricular activities, my extracurricular activities consist of I mean, I'm really a boring person, to be honest. I mean, extracurricular activities would be like, I'll be going out with my family and friends for dinner, coffee, I mean, and obviously I love music, so I'll play my piano to distress. How to manage time well, actively involved in both. How to juggle time. I think time management is very important. And I think the previous two speakers, Dr. Tan, Prof. Faisal, right, they mentioned about time management. And time management is so important. And I feel in this day and age, if you want to manage your time well, you cannot be easily distracted by your phone, by whatever, So I think in social media is a huge distraction, right? I think. I think sometimes I'm also distracted. I'll be like writing up a research paper and I'll be like, oh, let's see what Khai Siang posted on Facebook. Okay. No, I don't. But I mean, no, I'm just saying, I think being focused and there was, I think what's the name of that student? She was my student. She's really graduated. Yuzan, right? She co-authored a book, right, with Prof. Tan on mindfulness, right? Yeah, Yuzan, yes. So mindfulness, I think it's time that all of us practice that, because I think just be in the present, focus on what you're doing, and then after that you can play your PS2 or whatever lah you want to play. Okay, your video games. Yeah.
And here I think is the last question. What is your advice for those who fail to secure a place in UPU lately? UPU is the admission.
Yeah, the central, right?
Yeah.
Oh dear, I guess you can appeal. I mean, isn't it? You can appeal, right?
Yeah.
But sometimes I
If you
always
really-
feel, yeah. Okay, Kaisa, maybe you know better than me. You can appeal, right?
No, I think it's like if you really want to do medicine in there's another pathway, right? It's like direct intake.
Oh yeah, direct intake. Yeah, the satu channel.
Yeah.
The saluran terbuka. Yeah, you can.
Another saluran terbuka.
Yeah, terbuka. Yeah, that's right. Yeah, correct. Sorry, I totally forgot about that. Yeah,
And Dr. Nadia is one of our interviewers also.
No, not for this year. I'm not doing it. Yeah, but yeah. So you will not be seeing me there. Okay. Yeah, but that's definitely yeah. So luckily you remember that. I totally forgot about Satu. Yeah, you can apply through the Saluran Terbuka channel. But sometimes I feel in life, if you don't get something, there is a reason for it. I feel maybe you're meant to do something else, right? So. And maybe, I mean, I'm not saying that you shouldn't try. I mean, if you really feel medicine is for you, please, try and appeal or go through the Saluran Terbuka channel. But sometimes if it doesn't happen, it's maybe not meant to be, and it's maybe you might be happier doing something else. Because I not initially when I was younger, I was thinking that if I don't do medicine, I might do dentistry. So maybe if I was a dentist today, I'll be happier. I don't know, happier than I am now, right? I don't know. I don't know. So, oh, good. Okay, so Jadi, yeah. So he pasted that satu thing. So I totally forgot about it because I'm not interviewing this year, so I forgot about it. Yeah.
Okay. So to wrap up this, Doctor, do you have any words to our medical students, both in preclinical years and also clinical years? Any words to our medical students?
Yeah, I think I just would like to say that medical school is tough. Okay, I mean, I went through it. Obviously, I mean, it was a long time ago. I mean, I'm very old now, but medical school for me was really not smooth sailing. I hit a lot of bumps along the way, and I have to say that there were a lot of moments in medical school where I wanted to quit, and I was, ready to pack my bags and fly back to Malaysia, because I felt like, oh my God, it's quite stressful. I mean, I adapted quickly to the culture and environment, but the workload and how much you have to learn and remember anatomy, like I was like, oh my God, okay. It was like, I think I can't do this. But I think what I did was I did some soul searching. I asked myself, is there anything else in life that I would rather be doing, and I would be putting I'm okay to be putting this much time and effort into, and and the answer that came back to me is no. So that's when I knew that medicine is for me lah. And I feel that whatever hardships that you're going through right now, if you fail an assessment or you fail an exam, please tell yourself that it's not the end of the world. Okay, I have failed many assessments in my life as well. So I think it's not the end of the world, and I think just to accept that medical school is not going to be full of sunshine and rainbows. There's going to be it's going to be very cloudy, a lot of thunderstorms. And if you can accept that the journey is going to be tough, it's sometimes going to be sad, and sometimes you will be crying, then if you have that mindset, I think you will embrace that whole experience in a more positive way. Because I know I do see students, I feel so sad sometimes, if they don't do well, or they get disheartened because a consultant had said something very nasty to them or something. I mean, just tell yourself that it's 10 years down the road, when you think about it, you'll be like, why was I so stressed about that? I mean, it's happened to me. I'll think back in medical school, like sometimes I was stressed or depressed or whatever. I'd be like, hey, why was I so stressed about that? it's nothing really. So yeah. Then you will find that medical school is quite fun. Yeah. Actually, it's so fun. I mean, you should be studying, okay? Yeah.
So,
Oh, okay. So Raymond is
okay,
good. So he's helping out that student.
yeah,
Okay.
yeah. So, thank you very much, Dr. Nadia. I think this is a very good session with you. So all the best, and also all the best to the stage 2 students who are currently in their study weeks. They are having exam next 2 weeks, I think. And also to my batchmates, stage 3.3 students, good luck and all the best in final year. Fighting. If you have missed any part of the, sorry,
You guys
Yeah.
will be back on the first, right?
1st
September?
of September. Yeah.
Okay.
Yeah, if you have missed any part of the live stream, you can always come to our MEDSOC Facebook page and watch the replay again. We will have our fourth episode, this one. Fourth episode on next Friday, 28th of August, 9 p.m. on Facebook Live. We have our host Anis Shaza and our guest Associate Professor Dr. Aizura Shafinas, a consultant obstetrician and gynecologist, in the next episode to talk about obstetric and gynecology. So please stay tuned. And once again, thank you very much, Dr. Nadia, being here with us tonight. And thanks to UMMC for having this Meet the Specialist session. Thank you for staying here with us tonight. All thanks to all the audience. And I would like to apologize for any technical issue. And I am sorry if I have made any mistakes here. So wish you all have a nice weekend. Goodbye and thank you. Bye-bye.
Bye, guys.
Bye,
Thank
Dr.
you.
Nadia.
Bye-bye.
Bye-bye. Bye, guys.